Have you ever wondered if your body might be sending you signals about the onset of serious illnesses? One of the first warning signs could be a change in your body odor. Sometimes, a change in smell is the initial subtle clue that something serious, including cancer, might be developing. Understanding these nuances allows you to recognize danger early when treatment is much more effective. Hello, I'm Dr. Ethan Hale. In this video, I'll talk to you about 8 different smells that could be linked to the emergence of various types of cancer. We'll dive into which odors to watch out for, what diseases they might indicate, and what steps you should take next. This knowledge will help you better understand your body and respond promptly to changes, preventing serious issues. Stay with me until the end because this information could truly save your life. At first glance, it might seem strange, but there's a scientific basis explaining why certain changes in smell can be associated with cancer. When a tumor develops in the body, it alters the metabolism of cells. These changes cause cells to release and accumulate different chemical compounds. Such compounds can react with the bacteria on your skin or mucous membranes, changing your usual body odors. Thus, subtle changes in the smell of your sweat, breath, urine, or even your skin can signal disruptions in your body and hint at the development of various forms of cancer. Cancer cells differ from healthy ones not only in tissue structure, but also in their biochemical composition. Under certain conditions, this can lead to the formation of unique metabolites and volatile organic compounds. These compounds are expelled from the body and can be detected as unusual smells. Modern technology is opening new horizons in identifying these subtle changes. Electronic noses are specially designed devices equipped with sensors that can detect even the faintest changes in the chemical makeup of the air emitted by the body. These devices analyze complex combinations of smells and help doctors determine if there are any abnormalities that need attention. Additionally, trained detection dogs with extremely keen senses of smell are used. They can recognize specific odors associated with cancer cells and have already proven effective in the early diagnosis of certain types of cancer. These methods confirm the scientific and reliable connection between odors and cancer. Research in this field shows that observing and analyzing smells can become an important tool in the early detection of diseases when treatment is most effective. Understanding how cancer affects metabolism and consequently body odor opens up new possibilities for prevention and timely diagnosis. The first unusual smell to pay attention to is a distinctive moldy or rotten odor coming from your mouth. This unpleasant scent could signal that serious changes are occurring in your oral cavity or throat. Normally, your breath has a neutral or slightly fresh smell, so a persistent moldy odor is atypical and warrants attention. The emergence of such a smell is linked to several processes in the body. Cancer cells developing in the mouth or throat can cause tissue breakdown. These processes lead to the formation of necrotic areas where bacteria and fungi accumulate. The decomposition of tissues, along with microbial activity, creates that specific rotten smell. Additionally, the tumor can disrupt the metabolism in the surrounding tissues, leading to the production of certain volatile compounds that enhance the unpleasant aroma. Besides the change in smell, early stages of oral and throat cancer may present other symptoms. Pay attention to the appearance of sores or wounds that don't heal, difficulty and pain when swallowing, or the feeling of having a foreign object in your throat. The color of the mucous membranes may also change. Red or whitish patches that noticeably differ from the normal state may appear. Dry mouth and difficulty speaking can be additional signs of disruption. If you notice any of these changes, we strongly recommend consulting a doctor. Early diagnosis in such cases is extremely important. A specialist will conduct the necessary examinations, make an accurate diagnosis, and prescribe appropriate treatment. The next warning sign could be a change in stool odor. The characteristic smell of decomposition that doesn't go away after dietary changes or taking medications. This unpleasant scent might indicate issues with your digestive system related to the development of colorectal cancer. Under normal digestion, stool has its usual odor, but the presence of a persistent, foul-smelling decomposition can serve as an early indirect sign of serious problems. Colorectal cancer causes numerous changes in the body that are also reflected in the smell of bodily emissions. Cancerous tumors in the intestines can affect digestive processes, leading to the formation of substances with strong and unpleasant odors. In addition to the change in smell, colorectal cancer often presents other symptoms that may accompany the disease. Look out for blood in your stool. It can be visible or hidden, as well as abdominal pain, changes in your regular bowel habits, frequent constipation or diarrhea. Increasing fatigue, unexplained weight loss, and anemia can also be associated with an oncological process in the intestines. If you notice that your stool has become more foul-smelling, accompanied by symptoms like blood in your stool, abdominal pain, or changes in your bowel habits, you shouldn't ignore these signs. It's important to seek medical help as soon as possible. Early diagnosis and timely treatment of colorectal cancer significantly increase the chances of successful recovery and minimize the risk of complications. Another important sign to watch out for is a sweet, unpleasant odor coming from the skin of your chest or from any wounds that might develop in that area. Normally, the skin on your chest has a neutral or slightly pleasant scent, so the appearance of a persistent sweet or sour smell could indicate unusual processes in the chest tissues. This odor can come from superficial wounds and sores, as well as permeate through the skin, pointing to pathological changes beneath it. Why does this smell occur? Cancer cells in the chest tissues alter the local microbiome and metabolic processes. The breakdown of damaged tissues and infection of surrounding areas can lead to the formation of specific compounds with a characteristic sweet smell. This odor can be the first sign of disruptions even before noticeable changes appear in the breast tissue itself. Besides the change in smell, breast cancer can be accompanied by other symptoms. These include the appearance of lumps or nodules, changes in the shape and size of the breast, redness, dimpling, or even retraction. Sometimes the nipple changes. Discharge may appear, its shape may change, or even inversion. All these signs require careful attention and monitoring. If you notice a sweet, unpleasant odor on your chest, especially in combination with other symptoms, it is extremely important to consult a doctor immediately. Remember that timely consultation with a specialist and undergoing necessary examinations can save your life and help effectively combat the disease. Another warning sign to pay attention to is the smell of hydrogen sulfide, reminiscent of sulfur or rotten eggs, coming from your mouth. Such a specific aroma can indicate problems with your stomach, including the development of stomach cancer. Normally, your breath doesn't have such a sharp and unpleasant odor, so the appearance of this smell should raise concern. The smell of hydrogen sulfide is directly related to digestive disorders. In stomach cancer, changes occur in tissue metabolism, leading to the formation of hydrogen sulfide, a compound responsible for the characteristic rotten egg smell. The pathological process in the stomach can also lead to the decomposition of food proteins and disruption of the microflora balance, which enhances the release of unpleasant odor molecules. These changes can be the first signals of serious disruptions in the digestive system. In addition to the change in smell, stomach cancer may present other symptoms. Pay attention to persistent nausea or a feeling of discomfort in your abdomen, which may accompany the unpleasant breath odor. Often, patients notice pain in the stomach area, especially after eating, as well as loss of appetite and unexplained weight loss. These symptoms, along with the unusual smell, heighten suspicions of a pathological process. If you notice a rotten egg smell from your mouth combined with persistent nausea, abdominal pain, or loss of appetite, it is strongly recommended to consult a gastroenterologist. A doctor will conduct the necessary examinations to determine the causes of the changes and rule out or confirm the presence of serious diseases. Another concerning sign to watch out for is the smell of rotting meat emanating from affected skin areas. This foul odor often arises due to necrosis, the death of skin tissues, which can be associated with the development of cancer. Normally, our skin doesn't produce unpleasant smells, so the appearance of a specific putrid odor should raise alarm and caution. The smell of rotting meat results from the breakdown of skin cells and the infection of wound surfaces by bacteria. In skin cancer, tumor processes disrupt blood supply, leading to tissue hypoxia and subsequent decomposition. Dead tissues begin to break down, releasing volatile compounds with a characteristic odor. This smell is one of the key signs of necrosis, which can accompany various types of skin cancer, including melanoma and carcinoma. In addition to the unusual odor, other alarming signs may appear on the skin. Pay attention to moles and other pigmented areas. Their color and texture may change, becoming irregular, uneven at the edges, or rapidly increasing in size. The appearance of unexplained sores that don't heal can also be a sign of an oncological process. Such changes are often accompanied by itching, peeling, or bleeding of the affected areas. If you notice a rotting meat smell on your skin, along with changes in the color and texture of moles, unexplained sores, or other suspicious alterations, it's important not to delay a visit to a dermatologist. A specialist will conduct a thorough examination and may recommend a biopsy or other diagnostic procedures to determine the nature of the changes. One unusual symptom to be aware of is the smell of ammonia in your urine. Typically, urine has a mild odor, but disruptions in kidney function can lead to a distinct, sharp ammonia smell. This is because the kidneys play a crucial role in filtering and eliminating metabolic waste products. In kidney cancer, the structure and function of these organs are impaired, leading to the accumulation of toxic substances, including nitrogenous compounds. These compounds break down and give urine its characteristic ammonia scent, which doesn't go away with dietary changes or increased water intake. The presence of an ammonia smell in urine may also be accompanied by other symptoms indicating potential kidney problems. Pay attention to back pain, especially in the lower back area. It can be caused by a tumor pressing on surrounding kidney structures or the spread of the disease. Persistent fatigue and a general feeling of weakness can also be signs of impaired kidney function, as the body struggles to effectively eliminate toxins. Unintentional weight loss, often observed in the early stages of kidney cancer, is another symptom to watch for. If you notice that your urine has acquired an ammonia-like smell, along with symptoms such as back pain, fatigue, or weight loss, it's important not to ignore these signs. Seeking medical attention promptly is crucial. A specialist will perform the necessary examinations, including a urinalysis, ultrasound, or other imaging methods, to accurately determine the cause of the changes. One unusual symptom that might indicate cancer is a metallic odor coming from your mouth or sweat. This kind of smell is often perceived as a faint scent of iron or metal and can occur without any obvious reason. Such a change in odor isn't typical and warrants paying closer attention to your health. Why does a metallic smell occur? It's related to an imbalance of iron and other elements in the body, which is characteristic of blood cancers. In leukemia or lymphoma, the normal structure of blood-forming cells breaks down, disrupting their metabolism and affecting the body's overall chemical makeup. Excessive accumulation of free iron and its byproducts can lead to a distinct metallic odor. These chemical changes can show up not only in your breath, but also in your sweat, making this a noticeable and important sign for early diagnosis. In addition to a metallic smell, blood cancers often come with a range of other symptoms. You might experience increased fatigue and weakness that doesn't improve with rest. Frequent infections due to a weakened immune system, persistent fever, and night sweats may also indicate a serious condition. Sometimes unexplained bleeding, bruising, or swollen lymph nodes occur. If you notice a metallic smell in your mouth or sweat, along with these symptoms, it's important to consult a hematologist right away. A specialist will perform the necessary tests, including blood work and other diagnostic procedures, to determine if there's an oncological process and to start treatment early. One of the unusual but concerning signs of lung cancer can be a sweet, fruity odor coming from your mouth. Normally, your breath doesn't have a pronounced sweet aroma, so the appearance of such a smell should catch your attention. This unusual change can be one of the first signals that something is wrong in your body, especially if the aroma persists for a long time. Why does the smell occur in lung cancer? Lung tumors can affect your body's metabolism, including the breakdown of certain substances that have a fruity or sweet smell. This may be related to the buildup of ketones or other metabolites that are expelled through your breath. Besides the change in smell, the disease is often accompanied by other noticeable symptoms. A sweet aroma in your mouth might come with a persistent cough that doesn't go away for several weeks, shortness of breath, wheezing, or difficulty breathing. Sometimes it's accompanied by chest pain, especially when taking a deep breath or coughing. Keep in mind that these symptoms don't necessarily mean you have cancer, but their combination should definitely catch your attention. If you notice a sweet smell in your mouth, along with a cough, shortness of breath, or other breathing issues, it's important not to delay a visit to your doctor. Reacting quickly and consulting a specialist in a timely manner allows for the necessary tests, such as chest X-rays, CT scans, or bronchoscopy, to determine the cause of your symptoms. We've covered 8 different smells, each associated with a specific type of cancer. To wrap up our video, I want to emphasize once again how important it is to be attentive to changes in your body's odors. Understanding that changes in smell aren't random, but potential signals from your body can save a life. Cancer detected in its early stages is much more treatable, and each of us has the opportunity to play an active role in maintaining our health. I sincerely wish you good health, well-being, and confidence in tomorrow. And if you enjoyed this video, please give it a thumbs up and subscribe to the channel. I would be very grateful. Also, don't forget to share this video with your loved ones. Leave comments and ask questions. I'll do my best to help everyone. If you're not done yet, I recommend watching my next video, which will help you maintain your health. A link has already appeared on your screen. Take care, stay vigilant, and believe in the best. See you next time.